Hi everyone. I hope you are safe and at homes and in stressful times like this, you and your family are safe. In last few days of lockdown, I've been thinking that is there any positive side of all of this? And this started me to think that actually plastic surgery as a specialty got developed only after world wars. That was a good side of the world wars, if I can say that. So I thought let's discuss about evolution of plastic surgery. क्या आप जानते हैं कि प्लास्टिक सर्जरी डेवलप कैसे हुई? And do you know the role India has played in development of plastic surgery? Let's discuss about this. Hi, I'm Dr. Rajat Gupta, board certified plastic surgeon working in Delhi. And I'll be discussing with you the evolution and the growth of plastic surgery over centuries and the role India has played in that. Do you know who is regarded as father of plastic surgery? He's an Indian saint with the name Sushruta. In fact, it is said in 6th century BC, Sushruta used to do skin grafting. This has been mentioned in his book called Sushruta Samhita. And this book is read across the globe. In fact, that's why across the globe, people consider an Indian as father of plastic surgery. So you see, plastic surgery actually started developing as far as before Christ era. The other thing which I wanted to share with you, that one Indian ruler actually helped plastic surgery to develop as well. See, in around 1000 AD, there was a ruler in Mysore with the name Tipu Sultan. I'm sure you must have heard about him. Now, there was a bullock cart driver during that time with the name Ojasvi. Now, as the saying says, that this Ojasvi actually committed a mistake. And Tipu Sultan didn't like it. And during that times, the punishment Tipu Sultan used to give people was to chop off their nose. Yes, you heard that right. With his sword, he would chop off the person's nose who would not like it. At that time, as the saying says, that there is a Maratha potter who saw that, and with the help of his sculpting skills, which potters have, he created a tissue from the forehead area to mimic the nose for Ojasvi. This was witnessed by two Britishers, and they in fact wrote in their gazette also, which was published later on in Britain, about how the nose was reconstructed using the principles of plastic surgery by a potter and some surgeons in India. In fact, it is also said that Ojasvi was then later taken up for a job by British Army, and he got pensions from Britain as well. Isn't this very interesting? That how a diversity, a ruler chopping off someone's nose, helped a procedure to develop. And then came the big two world wars. Now, with world wars, there were many Americans and European soldiers who were traumatized, who had loss of their eyes, nose, hands, legs, and all not kind of trauma. Now, the surgeons or the plastic surgeons at that time had to reconstruct those things. If someone had a very deformed scar on the face, they had to improve their face. So their techniques of facelift got developed. So you imagine, a trauma was improved by reconstructive principles of plastic surgery, and then these surgeons, since they are now artists, they now understand how to improve a normal looking face as well without any trauma, so that they can do a facelift surgery. This is how plastic surgery developed. In fact, 1931, first public facelift and rhinoplasty was performed in America. So, World Wars actually helped develop our specialty. Now, plastic surgery as a word was described in 1798 by a Greek surgeon, Pierre Desalt. Now, plastikos is actually a Greek word which means to mold. And by that time, it was understood that plastic surgeons are like artists, like sculptors, and they mold the existing tissues in the body to either reconstruct or add beauty to existing features. Isn't that interesting? Even in 1798, people got to know that how plastic surgery can improve any part of their body. However, at that time, use of surgery was slightly restricted because anesthesia was not that developed. Only by 19th and 20th century, when the developments in anesthesia happened rapidly, that people started doing surgeries much more easily. In fact, there is a notification that in 1890s, there was a chief medical officer in Junagad, India, with the name Tribhovandas. Now, this gentleman did a rhinoplasty and wrote this in a book describing very detailed about how he gave anesthesia. You see, by that time, only wine and alcohol was used to sedate or anesthetize an individual. So this was again one of the first coming from our very own India. Now, during these times, modern father of plastic surgery, Sir Harold Gillies, came out in prominence. Now, this gentleman was a plastic surgeon working in France, and he improvised his techniques treating the soldiers, the general public, who had suffered due to World War, and then used those new abilities, the tools which he developed during these times to improve normal individuals and develop cosmetic surgery as a branch. Similar times, in something around 1950, two plastic surgery departments developed in our very own country in medical colleges. One of them in Patna under Professor Dr. R. N. Sinha, and the other one in Nagpur under Professor C. Balakrishnan. In fact, Dr. Harold Gillies himself visited India and also inaugurated the first chapter of Association of Plastic Surgeons of India. You see, from those times till today, India in every state have multiple medical colleges and multiple plastic surgery departments in each of these colleges where hundreds of postgraduates learn, study, practice and deliver plastic surgery to the common population. See, I've tried to make you understand that how plastic surgery has evolved from the times of Sushruta till today. India still is one of the most favorite destinations of people across the globe to come for plastic surgery services as well as cosmetic surgery. Of course, the tools have improved. Initially, people used to use a saw and a hammer. Now we have tools like microwaves, lasers, piezotome, very sophisticated, fine instruments so that we can deliver much more finer results with very, very nice finesse. But this history tells us that we should be proud of what India has developed. India was greater at that time, even great today. And in every adversity, we will come out much stronger. So stay home, be safe, all the very best.